Hello, hello. Hi, welcome to the Managing Your Brand and Maximising the Impact of Social Media webinar from the Royal College of Surgeons of England. So my name's Laura Hamilton. I'm on the council of the college and I'm a trauma and orthopaedic consultant down in Brighton. I'm not very good at social media properly. I've got a Facebook group that I created for women in orthopaedics a few years ago. And then from that, I went to Twitter, but I'm not an expert by any means. So I'm really, really looking forward to hearing from two experts we have here. So we've got Scarlett Nazarian, who is the queen of Instagram with the @female group. The female surgeon, I should say, is your tag. And then we've got Tasha Gandamiraja, who is the queen of YouTube, who does a lot of videos about breast surgery and surgery in general. So we're going to ask these two lovely ladies to speak to us today, and then at the end we'll ask questions and have a discussion. If you want to pop your questions in the chat, then I can read them all out at the end. Okay, great, super. Right, Scarlett, do you want to go ahead?
Yeah, thank you so much, Laura. Hello everyone, thank you very much for joining this webinar. Hopefully everyone can hear me. Thank you to the Royal College of Surgeons for inviting me to present today. My name, just to double it up, is Scarlett Nazarian. I'm a general surgical registrar in North Central East Deanery of London, and I'm also doing a PhD at the moment, so I'm based at Imperial College as a clinical research fellow. Some of you may know me on Instagram or my TikToks as @thefemalesurgeon, and I'll be talking to you today with Tasha later about managing your brand and maximising the impact of social media. Thank you. Next slide. So just to do a little overview of social media, as we all know, it is the hot topic at the moment. And unlike the good old days of newspapers, the TVs, radio, now we can get real-time events, information, and have real-time discussions on different platforms such as Instagram, Twitter, YouTube, LinkedIn, and so on. Of course, as well as the general public and use from a personal sense of view, surgeons and doctors are also using social media. And this is to debate, to share ideas, to disseminate information, whether there is new studies out there that people want to discuss, or to engage and empower the general public with information that they can use, and to especially to bust myths around certain health conditions, which is what I love to do. But all this taken into considerations, doctors and surgeons are professionals at the end of the day, and what's expected of them on social media is the same as would be in their place of work. And so it's really important to maintain the professional standards. And the GMC states that when using social media, doctors must maintain professional boundaries with patients or the public and maintain confidentiality. We'll go on to talk a bit more about this, but just to add to all of this, that unfortunately at the moment there is a lack of standards, policies, and guidance when it comes to social media and the NHS or healthcare, just because it's a relatively new thing, and unfortunately some of the hospitals and NHS trusts just aren't quick enough to keep up with it. Some hospitals, saying that, do have policies in place, so always check those policies on the intranet, and there are some teams that you can check with for social media guidance. But it's really important to know that, this is an area that needs to we need to build on, essentially. Next slide, please. So what are the GMC key principles? I would highly recommend you all go and familiarize yourselves with this before kind of embarking on a social media platform, just because it's important to take in the key things that you need to bear in mind so that essentially your GMC is not revoked from you or taken away because of something you may have put on social media. Firstly, it's all about confidentiality. So, of course, just like you would in your workplace, you need to maintain confidentiality, and that does not change when it comes to loading videos or pictures onto Instagram, TikTok, and so on. Next, privacy settings and security. And this is essentially the confidentiality personal to you. So you need to be careful about the specific personal information that you're sharing on social media. You know, be careful of what you're showing, what hospital maybe you're attached to, or where you live, some basic information and so on. So take care with that. Next, interaction with patients, and the GMC states that, you know, you should never ever provide specific medical advice to anyone, any one of your followers or audience on social media. And this is because it can become really, you know, a scary place when the responsibility is on you. Just like in your workplace, the responsibility is on you when you're sharing information with your patient. And so when it comes to social media, you must always make it clear, even if you get a Q&A about, oh, doctor, something really simple, you must always reply by saying that you're not their personal doctor. You don't know their personal history. You don't know where they live, what the situation are, what their background is, whether that's their medical background, their mental health background, and so on. And so you're just there to give general information, and you must not give individualized care over social media. Next, it's respect for colleagues and employers. And I think this is really important because you must maintain appropriate professional boundaries, just like you would face to face. Just because you're on social media doesn't change anything. And I think, you know, I'm always very careful about when you, even if you post about, you post a photo with other colleagues and things, to make them always aware where that photo is going, what you're doing with it, and also be cautious about the sorts of information that you share, or if you're getting into a rant on Twitter and so on, of where you work and what those professional boundaries might be. And, you know, take care to know that the impact of your posts and what your online presence means, you know, and be wary that unfortunately that may be scrutinized. Sometimes it's embarrassing, sometimes it's, you know, great when someone comes up to you, but other times, you know, you will get negativity in what you're doing, and you must take that into account, and know that, you know, you're accountable for your actions. And what if you're happy with what you're saying and everything's fine, then great. But if you're not, just to be aware of that and the impact of what you're doing with your posts. Next slide, please. So how to maximize the impact of social media and how to get started. Firstly, the number one thing is to define your goals. When I started out, I wanted to, especially with my Instagram, I wanted to firstly show that women can be surgeons, because I think that's one of the main things that was, for some reason, and especially in some countries, thought you can't. And secondly, to empower people with health information that's easily accessible and easily understandable, and that it busts myths. And that was what my why was. And you must always keep in consideration where you're going with what you're doing, and always go back to that why. And then it's about choosing the appropriate social media platform that's going to be good for you, whether that's Instagram, TikTok, Twitter, YouTube. How are you most comfortable in, you know, providing that information? How are you most comfortable doing that? Is it via video format and so on? And so choose it appropriately. Who's your target audience? When I started out, of course, my target audience were kind of, young people, maybe medical students wanting to get into surgery. But I also wanted, obviously, the general public, because I'm giving out health information. But a lot of surgery, unfortunately, is, elderly people, that get certain cancers, or that have certain general health conditions. And so it's difficult to get the young 20-year-old women to kind of follow me if I'm talking about pancreatic cancer, or removing your gallbladder, if you're not someone like that. So I try to, and this is the whole point of social media, to kind of adapt what you're doing to what your audience are wanting from you. And then it was kind of clear to go into things that does present to my general audience. So appendicitis, or breast conditions, or things to do with hemorrhoids, and so on. So things that, a lot more people will be needing information about. And then it's about creating content strategy. And if you can do this, then you're a step ahead of everyone else. And it may not happen at the beginning, it may happen along the way, and that's fine, but know where you're going and know where your route to that goal is. Next slide, please. So next, about the content that you're putting out. And the main thing I can say here is that consistency is key. If you can keep what you're putting out consistent, and that means, maybe once a week, once every 2 weeks, then that's perfect. It's been shown that, if you post every single day, the engagement you get from that is not as good as you would think. So if you're posting every day for a week and then you burn out and then you don't post again for 2 months, it's just not going to get you as far as posting every single week will. So keep it up and keep it consistent, and make sure you're putting it into, essentially, you're fitting it into around your work-life balance. Make sure what you're putting out there is valuable content. People want to, people are there to get the information that you as an expert are there to give. And so make sure that what you're giving is valuable, that they can take away, they can use, and they can learn from it. And make sure that that information is always evidence-based. If you're putting your credentials, you're an expertise in that field, then make sure that you're following guidance, you're following the guidelines, you're following the protocols about that health condition. Because at the end of the day, you're there as a healthcare professional to show that all the other things out there on social media, a lot of them are false information, and you want to try and tackle all of that and bust those sorts of myths. Keep it clear and concise, whether that's on a static post, and I love a kind of static post with presentation style, or whether that's in video format. Keep it nice and concise, keep it short and sweet, whether that's following a sort of sound trend, or whether it's as I said, a presentation slide format. And then the format of it, whether you go with the static slides, whether you go with a video, whether you go with a trending dance, as I've embarrassed myself several times doing in the past, whatever that is, go with it and choose that format. And that's fine if you have to adapt it, because it started off as static posts, then reels were introduced, or TikTok videos, and so it's fine if you then choose that format to go down. Next slide, please. And lastly, it's your branding, and that's where the impact really comes in. Keep your branding consistent. So whether that's a color scheme that you want to use, I use a lot of blue, pink, and purple mainly. I try and keep it those sorts of colors. A logo, the font, keep it similar, so that when people share whatever, your slides, they can recognize it as your work, essentially. And keep it consistent across all channels. Don't suddenly change it for whether you move on YouTube or TikTok and so on. And then the visual appeal. People like visual appeal. That's why we now are really into videos that we can scroll through, and no one's going to stop unless you're appealing to them visually. And so use high quality images, use infographics, use eye-catching information that's going to draw attention and increase the engagement, because that's what it's all about, to increase engagement, to increase the impact of what you're saying, and to spread it far and wide. Next, analytics. Analytics are so important, and you get so much information by knowing what your audience enjoy, what they're liking, what they're saving. And so it's really important to take into consideration what's doing well in terms of posts and videos and what's not. And so try and learn from that, try and build on that, and make your next video or post even better. And then lastly, collaborations. This is becoming much more popular recently, and it's a great way to get more exposure on your posts and to get your information out there. I recently did a video, for example, with basic sign language with Aziza and Asha, and this meant that not only was it on my page, but it was also on their pages. And so that's more people watching this video, more people understanding how to do their self checks. And so brilliant. It doesn't matter whether, essentially who you're collaborating with, as long as the message is going out there. Next slide, please. So engaging with the audience. This is probably one of the most important aspects and the bit of social media that I love, because although you have lots of followers, you don't get to see their faces unless you're interacting with them. And then you kind of get a sense of who they are and what they're like and what they like about you and what you like about them. And it means that they're very loyal and stick around for the highs and the lows. And it means that they can also get more out of it if you're keeping it interactive and engaging. So, regular Q&As, questions, answers, putting stories up with messages, polls, lives. Recently, I was in theatre, so I asked people what's the difference between these two suture types, for example, and it meant that people answer. And I also have the surgical quizzes that people absolutely love, and even non-medics message me saying, we love these things, and we love kind of, following along. So make your audience feel valued, and I think that will get you really far. Respond to messages and comments when you can. I think I try and do that as much as I can, and sometimes it's difficult, but trying to do that, because I sometimes get messages like this one where it says, like, I put up a video and story about my colposcopy experience, and someone messaged me back saying that they were, as they say, scared to death, I think, but the fact that me sharing all of what I had made them feel much more at ease, and that it had really made a difference. And that's what I value so much when it comes to all of these things. So yeah, monitor the feedback, whether that's positive or negative. And unfortunately, you will get a lot of negativity, especially depending on what the platform is. I find on TikTok, people are much harsher. At least with Instagram, they're your followers, you know who they are. Whereas, on TikTok, or I think I've heard also on Twitter, it's much more kind of harsh. But take it in your stride and remember that you're the professional, and whatever kind of is said on there, either ignore it or rise above it or respond in a way you would in a professional manner. And trends are really important to engage with the audience. Unfortunately, I have, as I said before, embarrassed myself by following a few trends in the past, especially on TikTok. But I think it's really important, because it means I can embarrass myself for 2 minutes to get the important message out there. Then you know what, I've done my bit, and it means that I've helped people, and that's great. And experiment with trends. It might not work for everyone. There are different types of trends, whether it's trending sounds, trending dances, trending kind of voiceovers, and so on. So see what works for you. Next slide, please. And then some advice and tips to finish off with. Remember that this isn't your full-time job, unless you're an influencer, in which it might be, but it's not my full-time job. And so I always try and remind myself of that, because I'm also a surgeon, a mother doing a PhD. I've got loads of things to juggle. And so if sometimes I don't post, or sometimes I don't get a chance to respond to some messages, you know, it's okay. And I think you have to try and you know, remember that and remind yourself of that. Also, I'm always trying to remind myself to not compare, and it's really hard to do when you're on social media. But remember that numbers aren't everything. It's the impact that you have. Whether the post gets 2 likes or 15,000 likes, it doesn't matter. If the one person that's seen that post, that information has made a difference to. So take that into consideration when, you know, looking at likes and saves and numbers and how many times someone's post is kind of reshared. Next, be genuine and stay true to yourself. You know, there's no point trying to be someone you're not. You know, once you get into your stride, you'll get much more confident in what you're doing, and you'll be much more confident in kind of doing stories and lives and all that stuff. But remember, always come back to your why and remind yourself of why you started all of this and what your goals were, and that will keep you kind of on a path. Don't be afraid to say no. I think that's a really, really good one, just in general life as well. But on Instagram and on social media, you will have people approach you to do things that you may not feel comfortable in doing. And sometimes it's absolutely fine to say no. You know, if someone comes to you saying, will you promote my supplement brand? And you would never ever take a supplement as a doctor, for example, then don't do it. But if you feel comfortable because you would normally do it, and you would, you know, tell your patients to do it, then, you know, that's what kind of I go by, as whether I should or shouldn't do something. As we've spoken about, it's not always positive on social media, and so you must prepare yourself for the challenges. And lastly, it can be a really kind of tough thing also to keep up with social media. It's not always easy, and sometimes it can have a real effect on your mental health. And I've seen lots of my friends and colleagues this happen to. And so it's always really important to know that you can take a break when you need to from social media. You know, get rid of the apps, switch off, and make sure that you're kind of giving yourself the time you need to just kind of replenish, renourish, get yourself back, and then you can come back. And you're okay, you might lose a few followers or not have kept up with your, you know, consistent kind of posting, but the people that need to be there will be there, and it's absolutely fine. So remember that. I think that might be it. Next slide. So thank you very much from me. And if you guys want to follow me, I'm at The Female Surgeon, and you can always email me as well, and that's my email. I'll pass you over to Tasha.
That was amazing. Thank you, Scarlett. Look, I have loads of notes.
Hopefully Laura's now going to join Instagram. So
I do need to. I'm not good on photos though. That's my problem. I don't want videos, and I sound like an angry northern man when I listen to my voice back. So I'm not sure Instagram's for me. We'll see. Right, that's brilliant. Thank you very much. So Tasha, if you want to give us your presentation, please.
Great, thank you, Scarlett, for a fantastic presentation, and thank you to the Royal College for inviting me to talk today. As you know, it's about managing your brand and maximizing your impact through social media. Next slide, please. Next slide, please. Thank you. So we're talking about personal brand, and in this context of the talk today, personal brand is, as Scarlett alluded to, it's, you know, how you are as a professional. So we're talking about, you know, you being a doctor, but you can also have a brand if you have a business. So it depends really what your why is. You know, what Scarlett mentioned. What is your why? What is your purpose? And a personal brand is a combination of these qualities, and they are. Antonio, you can press the next slide, please. So it's your qualities. Next slide. They are your values. Next slide. Your expertise. And lastly, it's your reputation. So it's a combination of all of these aspects. And it is essentially how people outside perceive you as an individual through your expertise, your skills, and what you provide as a service. So whether that's you as a professional or whether that's you as a business. Next slide, please. So why is personal branding important? Well, to be honest, many doctors don't particularly care about having a brand, to be honest. They don't really care about it. They're not interested, and that's absolutely fine. You don't need a brand to be a doctor, and doctors don't need to have a brand. But I guess, for those who are attending this webinar this evening, perhaps you have a slight interest in what personal branding is all about. And I think personal branding as a doctor can be quite useful. Next slide, please. It builds credibility and trust, and that's amongst not only your peers but also your patients by being visible. And if you have a strong brand, then it elevates you, I guess, amongst your peers, knowing that you can show your expertise, and patients also can gain trust and confidence with whatever it is that you provide to them. Next slide. It can differentiate you from your peers, and especially in this very competitive healthcare landscape, if you're wanting to get a job, for example, it can make you stand out amongst people who are doing the same things as you. Essentially, us doctors, if you're a surgeon, you are going to be doing the same stuff, but if you have a personal brand that's strong, potentially it can elevate you slightly. So it can differentiate you from your peers. Next slide. I think having a brand is the foundation of building relationships. And it's not only with your peers, but also with your patients. And there have been times when I've been in clinic and a patient at the end of a consultation would say, oh, by the way, I follow you on Instagram, or I've watched a video of yours on YouTube, and I'm really confident with our consultation, and I understand what you're talking about far better now. So thank you very much for that. And that happens quite a lot. We forget that actually there is a whole outside world out there, and health information is not just from us doctors. The first thing they do is Google you. So it definitely builds relationships. Next slide. And it can advance your career in some ways. Having a personal brand and being visible online and on social media can open doors. It can get you to speak, like today. I'm sure the college wouldn't have found me if it wasn't because of me being online and being visible. It can get you research opportunities. It can get you on boards in hospital, whatever. It can really help your career. So it's something that you shouldn't I guess neglect from thinking about. And next slide. And lastly, I think it can lend itself to influence and being a thought leader. So if you are visible, it can actually help you have a voice in a very noisy world. If you have a message that you want to put out there and create a positive impact, the only way to do that is really by being visible. It's impossible now in this day and age. It's possible, but it would be quite hard, I think, because everything is online. You hear news on Twitter first rather than the 9 o'clock news on television. So it's something that personal branding can do. Next slide, please. So how can doctors manage their personal brand? Next, please. So I think Scarlett has alluded to all of this, but I think essentially you need to define your brand identity. It's like what Scarlett said, it's your why. What are you doing and why are you doing it? And then obviously you need to build a strong online presence. This can be on social media, but it can also be, having a website or through blogs. But having an online presence, whatever it is, can really help. You need to create valuable, engaging content. again, engaging and interacting with your audience, and you have to learn and adapt all the way through. Next slide. So what is your brand identity? It's your why, as Scarlett alluded to. Why? What is your aim? Okay, so if you have a business, is being online or having a brand, that aim is to promote your business. If you have a private practice, for example, and that's your aim. Is your aim trying to be an educator? You know, are you trying to educate and disseminate knowledge to the masses? Are you trying to be an influencer? You know, whatever it is, try to define it and you know, and stick to that. And if you don't know what it is, if you're just starting out, that's fine. You just start. Action creates clarity. You know, if you don't start, you're not going to know where you're going. But that's something you need to think about at the start. Next slide. And then you build an online presence. You know, there's so many platforms out there now, and you have to align to your audience. Different platforms serve different purposes. You know, LinkedIn is for professionals. If you want to, you know, TikTok might be for a younger audience. Twitter is Twitter. And Instagram, you know, has a broader appeal. So find your tribe, find where your audience lie and where they hang out really, and build your online presence on that platform. And you don't have to be on every single one. That's impossible. I would just pick one or two, maybe 2 or 3, and just stick with those. Next slide, please. If you're going to be online, you have to do this. You have to create valuable and engaging content, because otherwise, what's the point? You are not going to be able to stand out. And you know, this is, I guess, you know, the cornerstone of what will make you stand out amongst the very noisy, very oversaturated social media, you know, participants. Next slide, please. And engage and interact with the audience. As Scarlett said, you know, social media has social in it. That's a clue. You have to be social with whoever is following you. Now, it can be quite tricky as a doctor, because you have to maintain that doctor-patient boundary, and you have to be really strict with that, and you have to be really mindful with that, because you will, you know, be asked medical questions, especially if what you're putting out there pertains to medical content. And you just have to be strict and say, you know, I'm really sorry, I can't give out medical advice. Please see your GP. But that doesn't mean to say that you can't engage with your audience. You know, you can answer questions that if they're generic questions, you can ask, you know, you can answer them, but engage and interact with the audience. Next slide, please. So what is social media? Well, according to Wikipedia, this is its definition. It's an online mediated technology that facilitates not only creation of information, but also sharing of information, ideas and other forms of expression via virtual communities and networks. So that is what social media is about. And it's actually quite a broad church. Next slide, please. Slide. Now, I didn't grow up with social media, I mean, the internet, let alone social media. You know, I need to go to the library to get my articles. You know, that's how ancient I am. But that doesn't mean that we can't embrace social media, because I think social media is here to stay. Next slide, please. So that's where I used to go to for my newspaper. Now we get blogs on Twitter. I listened to the radio before. Now we've got podcasts, you know, radio on demand. Letters, you know, snail mail. I can't remember the last time I wrote a letter. Now we can get DMs automatically from across the world, literally in seconds. Television. Now we've got, what have we got? YouTube, right? It's amazing. And lastly, used to get, you know, business cards to give to sometimes we still have them, but you know, instead we don't have them anymore really. We can use LinkedIn. So the world has changed, you know, drastically, and we have to adapt really. Next slide, please. I was skeptical. Next slide, please. Should doctors be on social media? You know, medicine, generally surgery specifically, we're quite a traditional kind of discipline, And, you know, I wasn't sure whether I should be on social media, to be honest. Next slide, please. I'm a surgeon. How would I be perceived by the outside world? You know, what you think, well, why is this surgeon on social media when they should be, you know, doing more important things? Next slide, please. Yeah, I'm way too old and I'm not trendy enough. Why should I be on it? Next slide, please. And the tech is too hard and too confusing. You know, I'm not millennial, can't be doing with this, way too complicated. You know, I can't do it. But, you know, we have to adapt if we want to embrace modern technology and participate in the modern world. That is, of course, if you want to have a personal brand. As I said, you don't have to have one if you don't want to. And you don't have to be on social media if you don't want to either. Next slide, please. You know, there are many doctors out there, health professionals all across the globe who are on social media. And these are all the reasons why they're on it, you know, for education, patient engagement, for research, continual medical education, branding, brand reputation, networking. So many people are, and medical professionals are on social media. And I think the trend is going to continue. Next slide, please. So how can you maximize the impact of social media? Next, please. As I mentioned, define your purpose and target your audience. Next, please. Provide valuable, engaging content. Next, please. Being authentic and transparent. I think that is really important. Not only being authentic, but, you know, being yourself and not being somebody that you're not. People can see through that, and people will be put off by that if you're not authentic. So do be mindful of that. And as Scarlett mentioned, collaborate. Scarlett, we need to collaborate because I don't think we've done that yet. Next, please. And utilize different platforms. But as I said, you have to find your tribe, find where they live, and then utilize that appropriately. Next, please. And stay updated. Next, please. Yep, this is very important. You need to adhere to ethical guidelines, and as doctors, it's even more important. Next slide, please. So there are, though, pitfalls to this. Social media can be a scary place. Yes, please. Privacy and confidentiality, we've already discussed. Next, please. Misinformation and misinterpretation. Now, I think a lot of many professionals, health professionals, come onto social media because of this exact reason, is to debunk myths and debunk all of this noise and misinformation that is out there. And so if you are going to go onto your social media, it's imperative on us to make sure that whatever we create and disseminate is reliable and accurate and evidence-based. Next, please. It is a time suck, social media. It's addictive, it's dangerous, and you really have to be mindful. You can be scrolling, I don't know, hours, and yep, I think Scarlett would agree, it is dangerous. So you have to be strict with your time and make sure it does not distract you from just doing, other things and just living your life. But yeah, be careful with that. Next, please. I think Scarlett already mentioned this. I think you have to be thick-skinned. You have to take this if you're going to be visible. There's no way. There's no two ways about it, really. Just be respectful. Don't get into a spat on Twitter because that's a really dangerous place to be. And just be mindful of your mental health. It can really be, impact. It can create a negative impact if you take it too personally. And people are very quick to criticize because they're behind an anonymized tag. They wouldn't be saying what they say face to face because they're too cowardly. So I wouldn't take it personally. I've had a few. You just scroll. Just either block it or delete it or just ignore it. Next, please. this is again very important. Again, I know we're going on a little bit about this, but it is a very fine line, and sometimes you forget about it. So you just have to be mindful about that. Next, please. And GMC guidelines you have to adhere to. So Scarlett really eloquently described all of that earlier. Next, please. So, you know, hopefully many of you are already on social media, and some of you may not be yet. And this is something that you might be thinking, you know, what should I do? I have no idea what to do, what to post, you know, what kind of form should I use? And I basically, you know, these are the things that I kind of abide by. And if you need some ideas, and these are, you know, pillars that you might want to consider. So I would educate, entertain, and inspire. Next, please. So education, social posts, social media posts. There's so many opportunities that you can use to put out educational posts. So many, and you have to, you know, we're all kind of, you know, experts in our fields. And even if you are a trainee, you're still, you know, way more of an expert than a non-trainee. You forget, you don't have to be a consultant to be an expert in something. So you can teach about what you're learning, even if it's how to tie a knot. That's, you know, that's really interesting. Or, you know, if you're teaching somebody, if you're teaching a junior, or teaching a medical student, you can put that up as a post. And your surroundings, you know, like Scarlett said that she was in theatre, you know, she was teaching about vicral stitches. There's so many things that you can teach with. So yeah, just be mindful of what these are, and before you know, you can post quite a few things on social media. Next thing, slide please. So this is an example of an educational post. We'll show the video.
Hi everybody, I am operating today and I'm just getting ready. I've just changed into my scrubs and I'm about to go to theatre. Got a few cases. One is a lady who needs a mastectomy and an axillary nodal clearance. And she's needing this because she has two cancers in the same breast which are quite far apart from each other, and so unfortunately breast conservation is not possible, and so she needs a mastectomy. And she also needs an axillary nodal clearance where all the glands are going to be removed, and that's because when she came to clinic she had a positive node on biopsy. So that's what I'm going to do today, and the other case is a small non-cancerous case, so that shouldn't take too long. I hope you're well, and catch up with you soon.
So that's one example, right? I was just at theatre, you know, literally less than a minute, and it's something quite useful, hopefully, and, you know, very educational. Next slide, please. Okay, this is another example. I was in clinic, and I thought I'll talk about what happens when you have a biopsy. So you can play the video on this, please.
So if you come to the breast clinic and you have a biopsy, what happens to that specimen? The specimen will be sent to the lab and the pathologist will have a look at it underneath the microscope. And from what it looks like, the pathologist will be able to say whether there's anything to be worried about. Just because you have a biopsy does not mean that you have cancer. Many times we would do a biopsy on things that we don't think is a cancer, but we want to make sure that we know what we're dealing with. Leave any questions in the comment section.
So yeah, so two examples of educational content, really easy. It doesn't have to be, you know, super duper complicated. If you're just starting out, simple things can be really interesting for non-medics. Remember, you know, this is social media and it's for the public, and they might be wanting to know just really simple things that we take for granted. Next slide, please. Remember, it has to be accurate, evidence-based, and within your area of knowledge. So don't veer outside your lane. It's really important. Next slide, please. So inspiring social media posts, you know, it could be quotes, it could be lessons you've learned, encouraging words, anything that you might think may inspire, you know, whoever's following you. Next slide, please. So this is an example of, a possible inspiring video. So, I don't know, 10 seconds. Hopefully that might, inspire somebody who wants to become a surgeon, who may not think, maybe, may have the fit to become a surgeon. So that's an example of one video. Next slide, please. And this is a video that actually the college collaborated with myself a year ago or so ago, and hopefully this is slightly inspiring to people. So we can play the video, please.
Hi, my name is Tasha Gendimihaja and I'm a consultant breast surgeon. And now you're the consultant, you're the big boss. But you might be wondering, what is it all about? So the Royal College of Surgeons have asked me to share 5 interesting things about what it's like being a consultant surgeon. Number 5, the most challenging thing I would say is that the buck stops with you. So you are nominally responsible for all the patients under your care. Conversely, the best part of being a consultant is that you can guide and impact treatment for all of your patients. Another best part is you can act as a role model for younger trainees and younger surgeons. Number 3, don't forget that your current colleagues and previous mentors are amazing resources to help you out. Just because you're a consultant does not mean you should stop learning. Make sure you update your knowledge and attend conferences. And the best pieces of advice I can give to any new consultant would be know your limitations and stay humble. Good luck.
Okay, next slide, please. So entertaining. Scarlett is far braver than I to be dancing, because I don't think anybody would want to see me dance, but you can if you're brave enough, and you can do some sketches as well. So next slide, please. So this hopefully is slightly entertaining. We can play the video, please.
Okay, so you're this? Yeah. But you want this? Yeah. Okay, so in order to get that, you'd have to do this.
Next slide, please. So what benefits have I received from social media? Next line, please. I've made numerous connections with peers as well as patients. Next slide, please. So this is an example of the power of social media. For October, which is breast cancer awareness month, last year rather, I made on YouTube a series of 4 videos answering 4 different questions, and I invited women who have had breast cancer to answer these questions, and I compiled all of the answers into 4 videos, and every single one of these women on these videos I connected via social media. So without social media, this wouldn't happen. And the feedback from this was immense. Everybody was so grateful to be able to share their stories. So that's an example of how social media can be so impactful. Next slide, please. Next slide, please. Speaking opportunities, like this event, as I said, you can get invited to podcasts, which I've been invited to. That's one of the benefits of being on social media. Next slide, please. Collaboration. Scarlett's been collaborating as well with others, with Copperfield and mine, all these charities. You can collaborate, and that's been really, really exciting and humbling to be able to help them. Next slide, please. This is an example of a podcast chat I did just recently with Dr. Dizon, who is a professor of medicine and a professor of surgery at Brown University at Rhode Island. We connected via social media. There would be no way I would have connected with him if it wasn't because of social media. And he's, it was a really fantastic conversation. It's going to be coming out on my podcast at some point soon. So yeah, social media is great. Next slide, please. And yes, impact. You can create some powerful and impactful things via social media if you use it deliberately and purposefully. Next slide, please. This is a recent paper that's just come out on the role of social media and breast cancer and how does it impact patients. So it's a paper that the surgical colleagues of mine, but also it's a qualitative paper where I invited two women who have had breast cancer, who I connected through social media, and asked them to share their story in this paper. Next slide, please. This was one of the quotes from one of the women. She says, there are plenty of medics, professionals, charities, and cancer specialists active on social media, and it's been really helpful for her during and after her treatment. And the range of educational information is enormous. This is her positive take out of social media. Next slide, please. Another quote from the other woman on the paper. Latest information on treatment and surgical options for patients. She's a trained patient advocate, and she uses and interprets all of this information to relay it to help her audience. So she has benefited also from social media. Next slide, please. And these are the things that you get if you use social media purposefully. I got this from somebody from Australia. She's really grateful for my Instagram. Somebody said that she just found me recently, and it's a great public service. And I'm someone's hero because I'm a woman in surgery being vocal on social media, and that's great. As Scarlett said, you can't see your community, but you get feedback from these DMs, and you can tell that actually it is making a difference. Next slide, please. So if you're still skeptical, maybe you want to listen to this video. You can play the video, please.
Hi everyone, my name is Bishoy. I'm a third year medical student at Barts, and I wanted to share my story with you guys about how social media has completely changed my outlook, both from my career prospectus and from a medical student perspective. It all started with my placement here at Broomfield. I was placed in the breast clinic, and I was put to shadow Miss Gandamiraja. And the thing is, when I started, I instantly thought, you know what, she does look very, very familiar. And it wasn't until about the third week in where one of the patients comes in to the routine breast clinic check, and she actually comments about how she's seen Miss Gandamiraja on TikTok. And it instantly just clicked to me. That's where I had seen her, and I went back to check, and, all was well. I was actually following her. So it was actually because of Miss Gandamiraja that I initially wanted to get into surgery, from watching her TikToks and from noticing how she talks about the actual process and the actual lifestyle of a surgeon, and all the myth busting, all of that kind of information, and I found it very, very useful in the end. Not only that, but also Twitter, Facebook, you find events and research opportunities there. All of these things have very much added up, and they've made me who I am today in regards to being a medical student and the types of things that I get involved with. And overall, I think, social media is incredibly useful when it comes to, not only research, not only mentorships, but also just, networking. Networking is so important within medicine. It's always good to go out there. It's always good to be, kind of extroverted with people. Just, introduce yourself. Get yourself involved with most things that you find. Obviously, you can't get involved with everything realistically, but it's always good to try your best. And thank you, Miss Gandamiraja, for pushing my interest towards surgery, even if you didn't know that you did in the beginning until I met you. But yeah, good luck, everyone.
Next slide, please. So yeah, that's it. Thank you so much for everybody, to everybody who's listening. And if you want to connect with me, do please. You can find me at Dr. Tasha G on most social platforms. Thank you very much.
Thank you so much, Tasha. That was really interesting. I love your quote, action creates clarity. That is such a good quote. I'm going to try and put it in my brain. It's true for everything. You can overthink things and panic and worry. And actually, once you start, you understand the process much better. It's the same as research projects or audit projects or any of the other things we do. So it's really interesting. So thank you, ladies. I'm just going to look in the questions. So if anyone's got any questions, if you pop them in the chat and I will read them out. So we have so far, we have a third-year military medical student and aspiring surgeon from Pakistan called Taha. Hello, Taha. Hello, Pakistan. Who wanted to ask about the viewpoint about online consultancies being carried out by doctors. Is it really a good medium to serve the patients and satisfy them? That's quite tricky. Do you guys have any experience with this? I was asked to do this previously and nothing came of it, but it did make me quite nervous.
Is this kind of a virtual consultation, or is it through virtual consultation? Well, actually, GPs are doing this now, and I think there are certain conditions whereby you probably don't need necessarily to go to the doctor for that. Certainly during COVID time, we did do that, as certainly as a breast surgeon, we were able to do that. It's a little bit difficult because obviously the majority of patients would come with symptoms, but there are certain conditions where you probably can do it virtually. So I think it's a complement to face-to-face interactions, and certainly even now I consult with patients on the phone. So my clinic's actually a hybrid clinics between seeing people face-to-face as well as phone consultations. And so, yeah, I think it does have a place in the delivery of medicine now.
Yeah, I would agree to that. I would agree with that. I don't have much more to. I think as long as it's an actual kind of patient doctor relationship over rather than social media and you're giving some sort of video message or something to them, I think as long as then, yes, I think that's where probably we're headed as a result of COVID.
Yeah, so my sister's a vet and they were doing online consultations in COVID with animals. So,
oh, wow.
So if you can do it with an animal, there's probably something. I think the caveat would have to be, it's certainly in the UK, I don't know about Pakistan, but in the UK, it would have to be more of almost like a pre-consultation discussion. So almost like this is what you may encounter when you see the surgeon or the doctor, and these are the kinds of things that talk you, this is the kind of information. So I think there'd have to be a caveat of, this is not a definite diagnosis, this is more of a general advice, discussions about what it could be, discussions about what might come up and what you need to think about before the actual consultation. I'd be very anxious about booking someone for surgery without seeing them face to face in person. I think that would be the tricky thing.
I mean, there are lots of things that you would need to examine, for example, the tummy or whatever for, and for that, of course, it won't work. But for example, a 2-week wait referral that we have in England for something colorectal related, and if you've got, that will definitely be going to colonoscopy, depending on the type of questions you ask, whether or not they have certain examination findings, then that's okay. But I think, yeah, absolutely. I think if it's going towards something where it needs intervention and you need to examine them, then you need to see them face to face.
Okay, there's another question here. I think this is Taha as well. The issue with social media is the trends and the content people want to watch. Will we be able to pull and target a large audience in order to educate them in the right way? Ooh, this is the big question, isn't it?
Yeah, I think that I think you can, you know, you're going to pull the type of audience to your information depending on what your information and what you're giving out and what the value of your you know, content is. And I think that's what's nice about social media, is that although when you sit in a clinic you're face to face with one other patient and that's the information that they're receiving, with social media you can have that impact on, you know, hundreds or thousands of people. And so I think that's so valuable to be able to share the you know, the information and the health content that you might have with loads of people. And I think that's where really kind of healthcare is going as well. It's going into the kind of very tech, very AI, very sort of that, you know, down that kind of technology savvy healthcare pathway. So yeah, I think it is possible.
Yeah, I think so. I think it depends where you are on your kind of, you know, your social media journey, I suppose. If you're just starting out, I would just create content and just put it out there. Don't worry about trends and, you know, kind of worry about who's going to come to you. That is not how you should see what you do. You know, that's not about it's not about the end goal. What you need to concentrate on is what you can control. You can't control who's going to follow you, but you can control what you can put out. So, you know, if you're just starting out and you're kind of slightly worried about it, just create content and just put it out there and see, and create content that you like. There's no point of creating content that really, you know, is difficult for you to do. Just do, and, you know, just do what's easy, do what you feel is right, do something that's interesting to you and excites you and brings you joy. It shouldn't be a chore. And then build on that, and then, you know, and then you'll kind of learn what you like to do, what resonates with people. It depends who you want to attract, who your target audience is. That's the key, as we've both mentioned. And I guess then, you know, if you're already kind of a bit more advanced, then you can hop onto trends and things like that. But if you just start, I don't know to how where you are, but if you're just starting out, then, you know, just concentrate on the content creation. That's my advice, really. And don't worry about the things you can't control.
I'm going to show my age again by referencing a Kevin Costner film called Field of Dreams, where he said the famous quote, "If you build it, they will come." So
That's right.
You be you, you be you. And if anyone likes you from anywhere else in the world, they will find you, and then they will spread it to people who are the same, and you'll end up with your little gang. I think that's good.
And it'll take time, and keep at it, because don't be put off initially because only 5 people are following you. That will build with time. So just do, as Tasha just said, what you're comfortable with, whatever you feel is within your remit, and the numbers will build. But don't, again, get, you know, overly you know, overwhelmed by numbers and followers and all of these things. Just do what you feel you're comfortable with, and it will grow.
Okay, we've got another question here. Have you had to get consent from people for content you have uploaded? How did you do that?
Asha, do you want to go
first? That's a good question. I think you always have to ask their permission to participate in whatever it is that you put out. If you are going to share patient kind of photographs, you know, sometimes people kind of show pre and post op pictures. That's definitely, you need consent for that. It's you have to maintain confidentiality at all times, and you always have to get their patient's consent for anything that you share that's not yours, that involves patients. So you have to get their consent 100%.
I think I've just done verbal. I'm not sure if you guys have got written consent for social media.
So in the majority, I think it's really important to check your hospital guidelines as well, because some of the hospitals actually do have recent guidelines about social media, so you've just got to be careful. I try and avoid where I can getting, you know, patients in a photo or whatever, but if they are, then always before doing it, and if I know I'm going to take a photo in that operating, I would get verbal consent, and that's just because that's fine with the hospital settings I've been in, but yeah, and again, it's all to do with what the patient feels comfortable, obviously.
So on our standard consent forms, it says permission to take photographs. So that's part of our standard consent form, but I think if you're using it on social media rather than just for the patient records, I think you specifically need to say, this is a really interesting X-ray, this is a really interesting photo. Can I share this on Twitter for teaching and training, or can I share this with my followers? And I haven't had anyone say no yet. I had a lovely 90-year-old who said, oh yes, please make me famous. So I haven't had anyone say no yet, and sometimes I do document in the op note as well, or the clinic letter, that the patient has consented. You know, if you want to document it somewhere, that's quite an easy way to do it rather than getting a formal consent form. Okay, here we go. Let's see what's next. So, what if someone is involved in plagiarization and copies content you create on social media? How do you deal with that? Ooh, exciting. I'd be very excited.
I can take this this one, because it has happened to me strangely a couple of times, where you kind of create a sort of I guess piece of content, and then I've seen someone who's done it practically the same. I think you've just got to be confident in what you've created, and, you know, feel comfortable that you've done it. And at the end of the day, if they have copied what you've done, let's say they've done another piece of content on the same subject, in the same trend, in the same way, that's fine. But at the end of the day, it's getting to more people. So I always come back to my goal. That information is getting out there. I'm not the person that I want, you know, like, it doesn't matter, because at the end of the day, that person's getting the likes because someone's reading that content and understanding that valuable piece of information. So if they're going to, for example, do their self-checks, or you know about the symptoms, signs and symptoms of bowel cancer, brilliant, you know, and that's the kind of logic that I go by. But I think it can be difficult to digest sometimes when you've obviously, if they're taking your name and photos, that's something else, because that's scam, and you have to you know,
report that.
Report it,
exactly.
Thank you. Report it was what I was looking for. But otherwise, you know, things will happen, and unfortunately, it's not one of those things where I can patent what we're doing. It's not, you know, you don't have overall, someone can copy what you're doing. And again, trends are, in a way, like, everyone does the same sort of thing, but when you see something, I think you just have to kind of rise above it and know that that information's getting out there.
That's really lovely. That's lovely that it's not about your ego. It's about getting the story, getting the information out there. So, you know, you're not John Cena who's trying to get a part in a film. You're actually just trying to get people to be inspired or entertained or knowledgeable. So it's really good process to think through. Okay, so we've got Tejas, who's an aspiring NHS neurosurgeon from India, who wanted to ask, how do you go about getting started on social media? I'm an FY1, can you give me some ideas? I'm a bit active in LinkedIn, but I find Instagram a bit too much. Is it okay to skip it given its popularity? Well, I need to know this, because I don't know whether I should be doing Instagram as well.
Well, I think it depends what you feel comfortable, right? So there are, you know, there's Instagram, TikTok, Facebook, but maybe not so much anymore, because yeah, it's not as popular now. But I think it depends on what you enjoy, and there are different platforms. So I would suggest just delve into those platforms, have a look, see if you're comfortable in what you see, and if you think, actually, yeah, I quite like TikTok as a platform, then just stick with that, or vice versa, Instagram. As I said, just don't overthink it. I think that's a form of procrastination, and you're not going to find the answer unless you actually just do it. And oh my God, you should see my old, my old posts were awful. But who cares, because if you're only going to get better, but you have to start somewhere. You're not going to be up here before you start there. None of us who are on social media gave birth to 500, 1,000 followers. We all started with 0, and we're all newbies. We had to, but you have to start. So don't overthink it. Just choose a platform that you think is enjoyable and kind of, you feel comfortable in. You may not feel comfortable on Twitter. You may feel more comfortable on TikTok, for example. You don't know, but you have to try, and just don't overthink it. Just do it. Just post it. Do it. Just post it tonight. Anything. Just post anything.
Just do it.
Just post it. Just do it. Yeah.
I think what
That's
you said
my
was
advice.
really interesting, Tasha, when you said these really simple little nuggets that might seem really boring or not interesting or important to us, but things that we like, even like as an FY1, you could explain what it's like to put a Venflon in,
Yeah.
You could explain how long the blood tests take to come back, or, how you work your way around an x-ray system, or how you look at a chest x-ray, really things that you do lots that you feel that maybe you would teach medical students, and then medical students could describe things the way they'd explain it to their mum. So there's always something that you understand that you can explain to someone kind of down the knowledge chain. So I think anyone could probably do a useful video, really. Anything else to add, Scarlett?
Yeah, absolutely.
Yeah.
Absolutely. And I think that a lot of people aren't comfortable because of showing their face or talking. And so that's why it's important to pick the social media platform that's most comfortable, as Tasha said, for you. So maybe Twitter will be better for you then, because then you can just even do a line, every week, just about something you've read, or a question you want to ask your, peers and colleagues, and or just on Instagram, for example, put a photo, as you said, of an X-ray that you find on an image bank, and then talk about it in the captions, and that's your way of adding to it. So there's lots of ways to go about it. It doesn't have to always be kind of, a video or you dancing or whatever. So that could be a nice way to start as well.
Thank you. So I've got another question here. How much time do you spend on social media, including answering messages and creating content every day on average? Probably too much for our mental health.
Yes, I think screen time has become definitely very unhealthy recently, but I don't have a set time, so I can't answer this with a set time. I think, and I'm sure Tasha doesn't, unless she has a set time, but it's important if you can. I mean, if you can, say every week I'm going to set aside these 2 hours to sort out my social media, to either make videos, edit them, post them. But personally, I find it goes up and down. And if I have weeks where I'm really busy, I don't post as much. And other weeks where I'm free, I try and, create lots of content so that I can then spread it over. The best thing is to try and, when you sit down to create some content, try and create as much content as you can. And then you can use that, sporadically throughout the days or weeks coming. But I would say, minimize it where you can, because it can, as Tasha said, you can get into a scrolling kind of little hole, and so try and minimize it and think of your mental health, and when you do it, either put a kind of target time on it, or you can lock out or something, because I'm definitely someone who sometimes spends far too much time scrolling on TikTok, but yeah, I don't know, Tasha, if you have any more.
No, I mean, as Carla said in her talk, we have other things. We're not full-time influencers, so that is not our job. We have other things to do. We lead busy lives, whether you're a trainee, whether you're a medical student, and it can be quite difficult. Now, in an ideal world, I would say, okay, I set aside, I don't know, 3 hours a week, and I batch content, and I do all the editing, and I map it out, and I schedule it in advance and all of that. That would be ideal. The truth of the matter is, I don't do that either. I do, if you can, as Scarlett said, batch content, but it is hard. You know, it takes a lot of time, and that's why it doesn't have to be perfect. And you know, you can do it on the fly if you want to. It doesn't have to be perfect. I think we all think, and me too sometimes, that, you know, if it's not perfect, I'm just not going to put it out. But your idea of perfect is, it's never gonna, you're never going to achieve perfection. And, you know, 70% is good enough. You know, just put it out there. You can burn out if you get attached to it. And, you know, I've been really busy past couple of weeks, and my content, you know, output has dropped, and that's okay. You know, I'm not attached to the number of followers I have, because that's not my why. I don't particularly care how many followers I have. You know, I would rather have, I don't know, 1,000 followers, say, and that's quite a lot, you know, hypothetically, 1,000 followers who are thoroughly engaged with you, you know, like your content, participate in things that you do, over, you know, 100,000 followers who just don't engage with you. I would rather have a small number of followers, and they know we're all busy. So I wouldn't be too worried about churning stuff out. If it's once a week, once every 2 weeks, it's okay. But if you can batch content, that would be ideal.
That's brilliant. Thank you very much. We're getting lots of questions, but it's actually been an hour and a quarter now. So I think what our lovely admin team are going to do is try and forward on your questions, if you continue putting them in the chat, and then they can be replied to in a leisurely manner after we've all had some dinner. But thank you very much for coming, everybody. Really lovely to see so many people interested from all over the world. And thank you, Scarlett and Tasha. Lovely to meet you. Hopefully I'll see you down at the college at some point. Have a lovely evening, everyone. I think we're just going to sign off now.
Thanks, everybody.
Bye. Bye.